Hi everyone, my name is Lu Wan. I currently work at the Medical Genetics Center, Jiangxi Maternal and Child Health Hospital. Today, I will share a case of asparagine synthetase deficiency. About 2 years ago, a pregnant woman underwent cesarean section at 34 weeks due to abnormal fetal monitoring and umbilical carnot. Unfortunately, the baby was born with shortness of breath, cyanosis, spitting, and immediately sent to the intensive care unit. Physical examination demonstrated normal temperature, irregular respiratory rhythm, microcephaly, and lower muscle tension. Arterial blood gas analysis indicated elevated partial pressure of carbon dioxide and low oxygen partial pressure. So, the baby was diagnosed with neonatal asphyxia and respiratory failure. Since the baby had microcephaly and other phenotypes, and the TORCH test wasn't conducted during pregnancy, the possibility of virus infection was suspected. Then the baby was given TORCH test, quantitative detection of cytomegalovirus, blood culture, and sputum culture. All the results above were negative, thus the related virus and bacterial infection were preliminarily excluded. At the same time, the baby occasionally had a convulsion. Cranial ultrasound displayed brain structure changes and intraventricular hemorrhage. Because of no improvement after treatment, the baby was transferred to a superior children's hospital. Some tests were performed after the baby was hospitalized. Echocardiography showed normal cardiac structure. Brain CT scanning displayed epidural effusion. Due to the abnormal neurological symptoms, it was considered whether the baby had genetic metabolic disease. However, there was no obvious abnormality found in blood-thin mass spectrometry, considering feeding difficulties, developmental delays, and ineffective anti-epileptic treatment. A gene test was performed. The DNA samples of the family were investigated by whole exome sequencing, and the results revealed that the baby had compound heterozygous variation of ASNS gene, which was associated with the incidence of asparagine synthetase deficiency, ASNSD. ASNSD is a rare autosomal recessive metabolic disease caused by mutations in ASNS gene at chromosome 7. The loss of asparagine synthetase function, especially in the brain, is the main reason. The clinical features of ASNSD are growth retardation, congenital and progressive microcephaly, respiratory insufficiency, feeding difficulties, and epilepsy. Molecular diagnosis is the best approach. Moreover, the prognosis of ASNSD is poor and there is no effective treatment except supportive therapy. Sadly, the baby died when she was 4 months old. And 1 year later, the woman was pregnant and came to our Center for Genetic Counseling. The heterozygous variation was likely to be the pathogenic, but the possibility of other pathogenic variation was not completely excluded. There was a risk of only detecting mutations of ASNS gene. After continuous communication and explanation, the couple insisted to undergo prenatal diagnosis. Then, our laboratory extracted amniotic fluid DNA, and the single sequencing was used to detect the mutation. Finally, the results suggested that the fetus carried the same ASNS gene mutation as the mother. The couple decided to continue their pregnancy, and postpartum follow-up showed that the neonatal indicators were normal. In this case, the laboratory results assisted clinical diagnosis and also provided the basis for prenatal diagnosis during rebirth. Blood-thin mass spectrometry is a routine screening which could detect nearly 50 kinds of genetic metabolic diseases. However, there are more than 1,000 kinds known. With no problems found by blood-thin mass spectrometry, it cannot be excluded whether the newborns have real genetic metabolic disease. The clinical symptoms of ASSD are diverse and nonspecific. It could be considered in any children with growth retardation, microcephaly, and seizures. Patients suspected of ASNSD should undergo whole exam sequencing as soon as possible to confirm. This is all of my report. Thank you for your attention.